Hello, I'm Dr. Ju-won Suk from Wooridul Spine Hospital. We often see patients who come in because their lower back suddenly hurts so much that they can barely move. Many assume it must be a herniated disc, but in fact, not all sudden back pain is caused by a disc problem. First, it's important to understand what can cause sudden lower back pain. One common cause, of course, is a herniated disc, also known as a lumbar disc herniation. This can lead to sharp pain when the disc presses on a nerve. Another common cause is what's called a strain. A strain is similar to a sprain you might get in your wrist or ankle, but it happens in your lower back. The spine is made up of many joints, surrounded by ligaments and muscles, and any of these can be injured. When a strain occurs in the back, it can be very painful. To help tell the difference between a disc issue and a strain, we often use the SLR test. While lying down, we ask the patient to raise one leg with the knee straight. If a disc is pressing on a nerve, lifting the leg can cause pain in the leg or make back pain worse. In the case of a strain, the pain usually doesn't get worse when the leg is lifted, because there's no nerve compression. Of course, not all herniated discs show up clearly on this test. Now, treatment differs depending on the cause. If it's a herniated disc and the disc is pressing on a nerve, the most direct treatment may be removing the disc material that's causing the problem. But if it's a strain, meaning the back was pulled or twisted, the approach is different. Just like with a sprained ankle or wrist, we often recommend limiting movement by wearing a brace. This helps the area heal properly. Medications such as anti-inflammatories or painkillers can also help, and resting for a while is important. Simple hot or cold packs can also make a difference. In general, heat helps to relax tight muscles. So, using a warm pack or even going to a sauna can be useful. Warm therapy can ease muscle tension and pain. That said, some younger patients may feel more relief with cold packs. It depends on the individual, so choose what feels better for you. If the pain is very strong at first, but steadily improves over the next few hours, you can rest and monitor it. But if a full day or two passes with no improvement, it's time to come in for a checkup. These days, we have advanced imaging tools like CT scans and MRIs. Making a diagnosis based only on symptoms feels outdated, in my opinion. If you're in pain, it's important to see a doctor. A proper examination and imaging can help identify the exact cause and guide the right treatment. To summarize, if your pain is easing on its own, you can wait a little. But if the pain is severe or not getting better after a day or two, don't delay. Visit a specialist, get the tests you need, and start treatment early. This was Ju-won Suk from Wooridul Spine Hospital. Thank you.